Hi, so now we're going to talk about peripheral pulse. This is sort of the second thing we're going to do. I've already done my AIDIT with Miss Blackmore here, and I did my 2 identifiers, and I've washed my hands. Those are going to be the things you're going to do with each skill set. But you can refer back to the blood pressure skill because I've already completed that. So first thing that I want to do is find her peripheral pulse. So I'm going to take her hand here and I'm going to kind of twist over and find her thumb here. And this is the best way that I can think of how to tell you how to find it very easily is if you follow the thumb back, you'll sort of find this little valley right here. And if you just slightly, just very gently palpate, you'll be able to find that pulse. And it's just sounds just like this. So the first thing that we're going to do is we're going to just feel it for a second, and we're looking for rhythm. So when I talk about rhythm, for those of you that don't have rhythm, we want to feel a nice, steady and that's exactly what I hear with Miss Blackmore here. If we did feel, and I'm just going to put your arm down for a second, Miss Blackmore, if we did feel a so we know that's irregular. So that's the first thing we want to identify. What's the rhythm like? Is it regular or irregular? And if you want to, in your mind, just sort of hum it out. Doom, 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 doom. That will help you kind of identify some of those irregular heartbeats that may be harder to feel. So now we're going to look for rates, and what we're going to do is we're going to count for 1 full minute. This requires that you wear your watch with your second hand. Not every room has a clock in it, so make sure that you have your watch with the second hand. I'm going to let her know that this is going to take a minute because sometimes patients can feel a little anxious if you've been sitting there for a while. So it's important to tell her right off the bat, this is going to take me 1 full minute. So I would go ahead and I would feel again, and I would count for that 1 full minute. This is my rate. So I've looked at rhythm now, and I've looked at rate. So the third thing I'm going to look at is the strength of the pulse. And we can identify this as +1, +2, or +3. +1 would be a weak pulse. So it feels sort of thready or weak. Maybe it's easily occluded as I push my fingers down on there. +3 would be very bounding. So Ms. Blackmore gave a great example of maybe you've run up a flight of stairs and your heart's sort of working to pump that volume around, and you feel your pulse and it feels very bounding. So even if you push down to try to occlude it, it would still pulsate. And then somewhere in the middle there is +2, and that would be normal. So if all of you were to find your peripheral pulse right now, that would be what +2 would feel like. And it's important that you identify that strength because it can give us really important information about actually how the patient's doing. So it's important that you identify rate, rhythm, and strength. The last thing I just want to make sure that you guys know about taking a pulse is that you never want to use your thumb. And we talked about that when we talked about blood pressure and finding the brachial artery. And that's because your thumb has its own pulse. So you never want to use your thumb to try to identify rate or rhythm or strength because you may be feeling your own pulse and get that mixed up with her pulse. So never use your thumb. Okay, well, thank you for letting me take care of you again, Ms. Blackmore. And again, I would follow all my closing AIDIT, wash my hands, and then move on to the next thing from there. So we're going to go right into respiratory rate because I think it's a great time to segue into that because we're going to kind of put these two skills together because they work more efficiently that way. So we would finish with our pulse, and in an effort so that the patient does not know what we're doing, we're going to continue placing our fingers there and watching her chest rise and fall. Remember, it's one ventilation for a respiratory rate, and that means one inhale and one exhale together. So one inhale, one exhale together. That's a ventilation. So that would be one. So I would sit here again for 1 full minute, and I would count her chest rising and falling. If it were hard for me to see her chest rise and fall, it's not for me. I could take her hand and kind of set it up here and count like this. So she doesn't know I'm doing it. Please make sure that your patient doesn't know, because if they do know, they tend to have some erratic breathing. They may try to slow, speed up, that kind of stuff. The normal respiratory rate is 12 to 20. Be careful here though, because just because you have a normal number doesn't mean that you shouldn't look at the bigger picture. So if I were to walk in Miss Blackmore's room and she was making a high-pitched noise, for example, I would then know, even if I got 18 for a respiratory rate, which is normal, there's still something not appropriate with her respiratory status. So in this case, she's got wheezes. Maybe you're standing next to the patient and you hear a lot of junk sort of in their throat. They're very roncorous. So it's not just a number. Look at the patient, look at the big picture. Thank you.